I am Dr Nitin Rathi, working as a senior pulmonologist in Dharamshila Narayana Super Specialty Hospital, Vasundhara Enclave. Dear friends, today we will discuss about COPD, Chronic Obstructive Pulmonary Disease. This is the disease which involves lungs in which the airway become shrunken. There is a obstruction in the airways that leads to breathlessness, cough, sputum, chest pain and other symptoms also. Basically, COPD is not a individual disease localized to lung only, it is a systemic disease, because in this disease oxygen level down, and oxygen is the main metabolic factor in our body. It can lead to diabetes, hypertension, heart diseases, osteoporosis and brain disorders. In this, patient came to us in the OPD with the exertional breathlessness, cough, chest pain and sometimes mild hemoptysis. Mainly risk factor is tobacco. Patient is a smoker, patient is taking a different kind of oral tobacco or inhaled tobacco. If the patient is occupationally in industrial area, or patient may be using chula smoke. These are the main risk factor in India. How can we diagnose it? We have to take the proper history of the patient and we have to take smoking history, different kind of, whether he is taking inhaled smoke, chula smoke or pollution, and we have to do some simple blood test just like CBC, LFT, KFT and the blood sugars, and do a plain imagings. In this, chest X-ray is essentially normal. Then we have to do some other tests just like pulmonary function test, in which we see how much the obstruction is there in the lung. And in advanced cases we have to do arterial blood gas and 6-minute walk test also. In rare cases, to see how much damage is there, we can do CT scan also. Now how we are going to manage it? We have to remove the risk factor first. If the patient is a smoker or working in a pollution area, then we have to quit this tobacco and ask the patient to leave the occupation. We have to advise the patient follow healthy lifestyle. We have to ask patient to take healthy food just like leafy vegetable, citrus fruits, lots of water, and we have to ask the patient to do light exercises. In the drug management, in the pharmacotherapy, there are two types of drugs, oral drugs or inhaled drugs. In inhaled drugs, there are different kind of therapies, nebulizer, inhalers and rotacaps. According to severity of patient disease, we have to give inhalational therapy. Simultaneously, if the patient is sick enough, we have to add oral tablets, just like theophylline and steroid. If the patient has infectious exacerbation, we have to add antibiotics also. In remission phase, we have to ask the patient to do pulmonary rehabilitation, and simultaneously we have to ask the patient regular vaccination also. In rare case, when the patient is not responding to treatment, we have to ask patient to go on oxygen therapy. In CT scan, if there is large bulla is there, we have to advise the patient for lung surgery also. In advanced cases, we have to advise the patient lung transplant also. So it means COPD is a systemic disease. In this, basically airways shrunken down, oxygen levels go down. It causes systemic side effects. It can be managed in a holistic approach, lifestyle modification, drug treatment, surgery if it is necessary, and lung transplant. There are very going research in the management of the COPD. We should treat it in a optimistic way. Thank you.